slow.
We have our patient sitting down. Now we're going to demonstrate a gait analysis. How the feet are supposed to be moving while we're doing the gait analysis, and then the interpretation of it. The camera's on the floor. I'm being videotaped by our cameraman. The camera that you're going to use in your offices are on the floor. It's a fantastic system, and we'll demonstrate that right now. So I'm going to have the patient stand up right over here. And Len will also demonstrate some of the things that we're doing. So in a normal standing gait right now, he could be seen with considerable pronation. If he rotates his foot out and up a little bit, there's the supination we want to correct and put his foot into neutral. Now we'll demonstrate with the other foot. And back down. Bring it down. There's the pronation. That is his norm. So if you stand natural for a minute, face the camera. Right here, you can see the full pronation of his foot. And if he was to rotate his foot up a little bit, that's neutral. This is where the casting should be taking place once we do the casting. So now we're going to do the gait analysis. Stand where you are.
Show the patient what he looks like.
You could demonstrate to the doctors also.
And this is where the patient's going to learn exactly what neutral is.
And what they're doing that's causing a lot of their pain, what their foot is actually doing. The patient will actually get to see this once you show it to them on film. So here's what we're doing now. I'm coming behind the front desk here and just clicking the camera on.
Notice it's only one simple click.
One click. I'm going to turn this to our cameraman just to show him and you. This is what we look like here.
And as you can see me, I'm only about 14 feet away, so most doctors have a hallway, a room, and it's so simple you could train any of your staff to do this. And Mark has a movie of every patient, so he has a record of what they were like when they walked in the door before he treats them.
Okay, once again, the camera is located on the floor about 14 feet away from the patient's feet. They're going to walk about 12 feet up to the camera and stop. So demonstrate that for us, please. Recording video right now.
Okay.
So now Len's walking along.
At a nice slow pace, and he'll tell me
Stop right there.
and even up both feet.
At this point, you can see quite clearly on the screen. Do you get that into the picture? Here's the patient's feet in his normal position. Now Len, like I demonstrated earlier, turn your foot up, the right foot first. There's that position we want to keep him in, subtalar neutral. Put it down. That's the pronation that the patient's actually living with. Turn it up again. That's normal for us. That's what we want to create in our offices so that the patient has support underneath that right foot when we put an orthotic in his shoe.
And usually tell the patient you're going to count 1, 2, 3 so they know to hold it in that position. They give you a couple seconds to get a good shot of it and then tell them to drop it down.
And drop it down. Now the left foot, same thing. Lift it up.
1, 2, 3.
Drop it down. There's the pronation again. Lift it up one more time. Drop it down. And
Now,
relax. Turn around for a minute.
Okay, before we turn around, this is just for the physicians. We normally have the patient turn around, but I'm going to turn around in a 45-degree angle so the cameraman can actually zoom right in. And let me know when you're close. And at this point, I'm going to bring up the right angle to subtalar neutral, which is approximately there. My heel look vertical in the middle of the leg. Well, I can't see the back from there, Mark. Only the cameraman's looking at me right now.
That's fine.
So now I'm going to drop it down. Then I'll bring this one up for the cameraman. Drop it down. And then at this point, you would have the patient turn around in the office, and you handle this part.
Once again, walk to the starting point.
I'll tell you what, let's show everybody how we bring the right ankle up now. 1, 2, 3, and drop it. Let's bring this one up. 1, 2, 3, and drop it. Now the patient is actually seeing their pronation. But I'm going to face the camera right now for the physicians, so you can see it better. I'm going to lift the right foot up to about neutral. 1, 2, 3, and I'm dropping it. And as I bring this one up, Dr. Mark's going to go on the ground and try to show you the deformity I have of about 9 degrees of 4-foot varus, which is why all the training is here. So when you send the cast in and you watch the other movies, you'll see how important it is to cast correctly. And that's how I can tell how the deformity in the patient's foot. So I'm going to bring this foot up and hold it here.
And right under here where you can place, right under here where you can place a bunch of business cards, that's where the deformity is. That should be held up higher in a neutral position throughout the whole foot, the ankle, the talus, the navicular, and the cuboid, and that's what we're going to try and stabilize.
Which is all built into our semi-flexible plastic orthotics, as you see when I molded the X18 on the film, and my famous dress orthotic has the same type of angles built into it, but yet it'll fit in sandals, ladies' dress shoes, men's tight loafers, running spikes, which is a new thing now, and soccer shoes. Now I'll turn around, and Dr. Mark would ask this patient, and he's going to ask me right now,
Okay.
to walk back. And at this point, he will tell the patient to walk back to the camera, but about halfway. And again, ask me to take the right foot and hold it up. Count 1, 2, 3. Drop it. Lift it up, the left one. 1, 2, 3. And then he would stop the camera. So please stop the film. Now at this point, when we play it back to the patient, you would take the mouse.
We should show them.
It's going to be hard for you to see it, but you would place the mouse on the right knee while you're showing this to the patient. And as you lift up, as I'm lifting the foot up to neutral, they'll see the knee rotate. And this is what you're going to get. Oh wow, no wonder my knee hurts. I didn't realize my knee rotates in and out. No wonder my hip hurts. No wonder my back hurts. If you're a PT, the people don't know why you were even sent there to get therapy. They don't understand that their ankle, their pronation is making the knee hurt. And that's one of the things you're treating for. Could be treating for the hip, tendonitis, fasciitis, all the problems in the bad back. So this movie is not just to help you sell orthotics. It helps to sell all your services in the office. And when Mark started to see the patients realizing what it is, I'll let him give you a couple of words on that, they automatically wanted to have the services. Before, they had no clue what the chiropractor would do for them. Is that correct, Mark?
Exactly, and from a chiropractic perspective, as we were shown, way back in school, structure starts from the ground up. So when we are putting in a custom-made orthotic into every patient's shoe, sneaker, workout boot, workout shoe, exercise shoe, slipper, ski boot, the foundation is supported all the way through whatever we're doing. And as long as we do the right chiropractic adjustments, we're going to have a patient that's going to respond better and be able to improve quantitatively. High heels as well. Sandals as well.